Welcome to One on One, the Daily Items weekly digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Geisinger pediatric oncologist Dr. Jagadeesh Ramdas, interviewed by Rick Dandes.
Hey, come closer. Word has it Sunbury Motors is preparing for their biggest truck sale ever. Pick from Central PA's largest selection of new Ford trucks with savings up to $16,350 during Sunbury Motors' massive September truck and SUV sale. Over 45 2019 Ford Escapes starting at just $18,180. Four-wheel drive 2019 Ford EcoSports are slashed to as low as $17,320. SMC has up to $8,000 off 2019 Ford Edges and up to a whopping $13,000 off Ford Expeditions.
Welcome to One on One. I'm Rick Dandes, and today we'll be speaking with Dr. Jagadeesh Ramdas, who is a pediatric oncologist. It's particularly appropriate, I think, today or this month, because it is Childhood Cancer Awareness Month. So, thank you so much for talking with us today. Could we begin by just telling me a little bit about yourself and your position here at Geisinger?
Thank you for inviting me for this participating in this event. So I've been with Geisinger since 2002, and I've been working as a pediatric oncologist, and I'm the director of the pediatric oncology department at Geisinger Medical Center at Janet Weiss Children's Hospital.
Okay, so let's get right into it. By the way, I'm curious about this before we get to something else. Is it true that childhood cancers are often biologically different than cancers that share the same name in adults?
It is true in the sense that the uniqueness of the childhood cancer is, first of all, we tend to see a lot of biologically diverse kind of like cancers in children, of which the leukemias are the most common childhood cancer. So if you look at leukemias, there are subtypes of leukemias, which we call it as the ALL, which is the most common type of childhood leukemia. And then there is the other uncommon types, the acute myelogenous leukemia, and then of course the rare ones. So again, in pediatrics, we tend to see more of childhood cancer, mainly in the form of childhood leukemias, and then followed by other kind of cancers, including childhood brain tumors and then childhood solid tumors, which include tumors like neuroblastomas and sarcomas and other kind of cancers. So again, we have learned a lot about childhood cancers, again about in terms of the predisposition, the germline predisposition, as well as what causes a childhood cancer. But still, there's a lot of things which we don't know.
A long way to go.
About childhood cancer.
We're going to talk about that a little bit later. Doctor, what advice would you give to parents whose child has been diagnosed with cancer? What questions should they ask of their physicians?
For a parent who's dealing with a childhood cancer, the first few days can be extremely devastating and extremely frightening and emotionally a roller coaster ride, because they're facing to make treatment decisions for their child. And again, they are certainly hearing some new words and about new treatments and all. So the first thing I would always tell the parents again is that make sure that you are in a center where really there is a lot of childhood-based clinical trials going on. What we call as we are part of a group called as Children's Oncology Group. Children's Oncology Group is the largest cooperative research organization in the world. There are about 220 cancer institutions which are part of this group. And so the aim of the Children's Oncology Group is we improve the outcome of these children with the cancer, and by participating in certain clinical trials which have dramatically have improved the outcome for these children. So again, I would tell the parents again is that make sure that you are participating, you are making sure that the center where your child is taken care of is a part of a COG network of institution.
That was going to be my next question. It's important to seek care from a pediatric facility.
Absolutely, it is very important that they seek a facility which has the expertise in managing childhood cancer. So when I talk about childhood cancer, again, it's a very multidisciplinary team of professionals who are involved. in taking care of this child with the cancer. So there is, of course, the pediatric oncologist are there, but as part of the team, we have very well-trained pediatric nurses, advanced level providers, as well as child life team also, who kind of like who makes sure that the child is not too emotionally and too much frightened by the invasive procedures and all, and what we saw with that patient all the time. And again, we have all the other expertise of the interventional radiology and the surgical specialties and all. Overall providing a well-rounded way to manage the child.
Yeah, you have to deal not only with the child who's in a position of needing help, but the parents. It's just a holistic approach.
That's right. Again, because parents are making the decision for their child, and sometimes the decisions are quite complex because we have to make a decision about a randomized clinical trial, about introducing an experimental drug as part of a standard of care. So parents have to make that decision. Again, is this going to be the right approach? Is this treatment going to be beneficial for my child, or is it going to harm my child? So the parents are making those kind of like decisions, and our job is as the physicians is to facilitate and help them to make that decision, guide them through their process, and help make sure that we are in the right direction and provide them all the support and care which they need during this difficult time.
What role or can the child's primary care pediatrician play a role in this as well?
Yeah, so the primary care physicians plays a very important role in this journey, again because every child usually have a primary care physician, and they are the first line kind of like a defense, I would say, because a child who has any problem, usually they go to a primary care physician, and the primary care physician is the gatekeeper who kind of like who directs these patients depending upon the complexities of their symptoms, and then decides when this patient needs a specialist to evaluate and all. So we make it sure that through this journey of this child going through a childhood cancer treatment, which can last about like 3 years, sometimes 2 to 3 years, it's important that they maintain the contact with their primary care physicians. And also it's important once they are done with the treatment that it's important for them to be integrated back into the society so they can function and they can be productive, and the primary care physicians play a very important role in making sure that these children are back into the mainstream and helping them through that process.
And I was thinking that once they go through a program of maybe radiation or something, and then they go home, then the primary care physician has to kind of take over and watching everything.
Yeah. So the treatment of childhood cancer includes, depends upon what kind of cancer, we have a very multidisciplinary approach. So if you are talking about a solid tumor like a sarcoma or a brain tumor, it has components of chemotherapy plus surgery plus radiation therapy. So these children are usually do need to be followed for a long period of time because we worry about late effects from our treatments. And so the childhood cancer, unlike the adult cancer, the survivorship and late effects becomes very, very important for these children because these children are like really, they are going to be looking for the next 30, 40 years of their life. We have to make sure that they are able to function well, that their disease is not coming back, and then because of our treatments that they're not getting any other secondary side effects. So for example, if we radiate a child, again, it is very important that we follow their hormonal functions, we follow their neuropsychometric testing, make sure that they're not having any other kind of like a secondary issues, and so the late follow-up becomes very important. And it's now becoming a very hot topic or a very important topic because we are seeing a high number of childhood cancer survivors, and so these cancer survivors needs to be followed for many, many years down the road, and we are learning about new things which are coming up for those population.
Okay, we're going to talk about that right after the break. We're speaking with Dr. Jagadeesh Ramdas, and we'll be back in a moment.
Hey, come closer. Word has it Sunbury Motors is preparing for their biggest truck sale ever. Pick from Central PA's largest selection of new Ford trucks with savings up to $16,350 during Sunbury Motors' massive September truck and SUV sale. Over 45 2019 Ford Escapes starting at just $18,180. Four-wheel drive 2019 Ford EcoSports are slashed to as low as $17,320. SMC has up to $8,000 off 2019 Ford Edges and up to a whopping $13,000 off Ford Expeditions.
Welcome back to One on One. I'm Rick Dandes, and we're speaking with Dr. Jagadeesh Ramdas, a pediatric oncologist at Geisinger. Doctor, I think let's talk now about cures. Are cure rates improving?
Yeah, absolutely. Again, in childhood cancer, especially the condition called leukemia, it's been a phenomenal success story. And in fact, the childhood leukemia, which is the ALL, has been considered as a model cancer, where other cancers are compared now to see the success rates and all. I can tell you in the last 30 years or so, our survival rates have drastically improved in childhood leukemias. We used to be in the 5-year survival rates in the 60%, and now we are crossing close to 80 to 85% for the childhood survival rate. And the reasons which has happened is very quite manifold. One is we have learned more about the biology of this disease. We have learned about what makes certain cancers more high risk, what makes certain cancers more difficult to treat. And so we are tailoring the treatment according to this. We are also learning more about the molecular basis of these cancers, learning more about what medications works better for certain cancers so we can target appropriately. We're also learning more about the combination therapy and what are the sites where the leukemias sometimes come back, and so target it in a preemptive fashion. So all these things, and also making sure that the patients are taking the medication regimen, we are addressing their adherence, the compliance to the treatments. All these things are coming, and really I'm seeing a dramatic improvement in a child with a cancer where the leukemia survival rates are now exceeding 80%.
Well, that's fantastic. You just touched on this briefly. Are you seeing some advancements in treatments that give you even more hope? I mean, I'm reading now about gene therapies and
Yeah, so the field of cancer has been really dramatic and extremely promising in the sense for many, many years we were stuck with only one option, which was chemotherapy.
Yeah.
And as we all know, chemotherapy is it's toxic, and it can cause pretty serious side effects and lasting side effects and all. So, and it causes some collateral damage with the normal cells also getting damaged. So we have moved further from chemotherapy into what we call as molecularly driven treatments, in which we have identified each cancer has their own kind of like underlying genomic signature or like the impression, where if we can target them in a more specific way, you are able to achieve a higher success and with less collateral damage and all. So the field is evolving from a broad chemotherapy into what we are calling as a molecularly based targeted kind of like treatments. And the treatments are also, we are coming into form of also immunotherapy, where like we are kind of like making our own immune cells primed for fighting against the cancer
I've read
cells.
about that, yeah.
So immunotherapy has now also been in the forefront of the cancer therapy, and it is slowly making into the field of pediatric oncology also. And already there are certain diseases like neuroblastoma and certain types of brain tumors where we have found that immunotherapy was able to give us a higher number of success rate than what was achieved in the past. So this is all a very exciting time period, and the way we are moving forward is how to combine chemotherapy plus an immunotherapy, and how do we use this in combination and then improve the outcome, but at the same time making sure you keep the patient in focus. Be aware that these are children who are going to grow up, and so you have to be aware about the side effects of these medications and focus more on the side effects, so that way you can go for the better treatments.
So I'm guessing you have to read a lot of research. Oh, so many things are happening so fast these days.
Yeah, so as I mentioned again, all these things has happened because of a cooperative group research. So unlike adult cancers, our pediatric cancer, the overall number of pediatric cancers are limited. So that's why it is extremely important we all group together and form cooperative groups and fight this battle on a collective way. So Children's Oncology Group has been in the forefront of this battle, and again the NCI, the National Cancer Institute, designated pediatric cancer and gave X amount of funding for the Children's Oncology Group to be the forefront in fighting the childhood cancer. And what I've seen is a lot of clinical trials which have come up, and the beauty of this thing is like it can be applied for a child who's living in the most remote part of central Pennsylvania, as also a child who's living in the city of like a New York or Los Angeles or Chicago or anything. So we are trying to provide a very uniform way of treating a child, and we assure the families that no matter which institution you are treated across the country, you can be assured that you are getting the most up-to-date, most standard of care treatments. And that has remarkably, I can say that the success rate has remarkably gone up. And for us, again, a standard of care is to make sure that a child is participating in a COG-based clinical trial.
What is the biggest hurdle these days in the fight against childhood cancer?
We have made some phenomenal success in the childhood cancer, and overall, across all the types of cancers, our success rate is now close to about 70 to 80%. Mm-hmm. But I feel, again, that's not enough. We need to make this 100%. So what are the obstacles we are facing? Well, there are certain very difficult to treat cancers. And the one important thing always we assess is like when we talk about solid tumors, is it localized or is it disseminated? Mm-hmm. So for certain disseminated cancers like a disseminated neuroblastomas or a disseminated rhabdos and a Ewing sarcoma, we are still struggling with coming up with very potent and effective treatments which can be, I can say that they are very successful. There are certain types of brain tumors also which we are struggling with giving a good treatment. So once we understand more about the biological features of these particular cancers, and there are a lot of researchers who are looking into trying to understand more about what is the biology of these refractory and very disseminated kind of tumors. How can we approach them in a better way and all? So I think more science needs to happen in which we learn more about these cancers. Mm-hmm. That's one thing. And the second thing also is always I feel is unlike very popular kind of cancers like breast cancer and colorectal where there's tremendous amount of funding to do a lot of research, pediatric cancer is always, to tackle this, we are always strapped of funding actually. And always I feel that certain tough to treat diseases like Ewing sarcomas and neuroblastomas, the funding which is available for the researchers to come up with new treatments are always very limited. And so once we give an incentive for the researchers to find out more treatment by providing more grants and support, I'm sure that will be tackled. And so more funding for these particular cancers are important. And then third again is I feel that it's awareness for families if there is any concern. I mean, like get them to earlier medical attention. So in that way, preventing this from getting too disseminated and all can also be helpful.
I think this is a good place to end the interview. I want to thank you. We've been talking with Dr. Jagadeesh Ramdas, a oncologist, and thank you for giving us some of your time. We'll be back with another one-on-one.
Thanks for watching One on One. Be sure to tune in next time for another edition.